Hello, Alyssa.
Hello.
It's good to see you today. I'm glad you came to see me.
Okay.
So, tell me a little bit more about why you're here.
Well, I guess I have anger issues. I just find myself getting mad all the time. And get in a lot of trouble over it. People can't handle it, so they told me to come here for it.
Okay. So who told you to come here for it?
The courts.
Okay. Okay. Got it.
So yeah, I don't really want to be here, but
So I'm not excited about being here. Yeah. Yeah, I hear that. Well, what is your objective? What do you want out of this today?
I mean, I know I'm probably a lot angrier than the average person. So, I mean, people do a lot of things to make me mad. So I guess that's like to figure out a way to not be so mad all the time.
Okay. And maybe manage that a little bit better.
Yeah.
Okay. Tell me, is it school when you're getting mad? Is it home when you're getting mad? Is it friends? So tell me about that a little bit more.
Just with my friends, I'm cool. It's just definitely at home with my mom. We fight almost every day. And at school, I get fights with the teachers. So I get like detention and stuff like that.
Okay. 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 So, before we get into this a little bit, I'd like to tell you a little bit about your brain. Okay?
Okay.
Have you ever heard of the amygdala?
No.
Yeah. When you get in high school, you're going to know about this in advance, but you're going to learn about this in high school science. So your amygdala is like right here at the base of your brain back here. And it's known as the alarm center. So you can think about pulling an alarm, an alarm is going off in your brain. And that alarm, normally it indicates fight, flight, or freeze. So it makes you want to fight back, right? It makes you want to freeze, you just kind of panic, freeze, don't know what to do. Or flight, which means get out of there, get away, all right? So that's kind of what your brain, that's the alarm system, that's kind of your brain. So let's think about some situations when you're in these angry situations. And let's just kind of step through them. So give me an example, really specific of maybe two. When the alarm is going off and you are really angry.
Yeah, I'm definitely a fighter.
Okay, you're a fighter.
Yeah.
All right.
Because just thinking just yesterday with my mom, she told me to do the dishes, which I was going to do. I just wanted the show to end. She kept, yelling at me to do it, and I didn't like the way she was yelling at me. And I just wanted to do like I was going to do it.
Mm-hmm.
Just wish she would just shut up about it.
Mm-hmm.
So, it just pissed me off.
Mm-hmm.
So I started yelling at her, and she started yelling at me. And then my little brother came in, and it was just the whole family. And everyone's just yelling at me, and I don't remember all the details, but I just remember I ended up punching a wall.
Okay.
That was just yesterday.
Okay, that was just yesterday. Okay. All right. So the situation, mom asked you to do something. You were kind of in the middle of something. She kept pestering you, and you started yelling. She started yelling. It starts escalating. You punch a wall. Okay.
Yeah.
Okay. Okay. I got that situation. Tell me about a situation at school when your amygdala, your alarm center is like going off. Tell me about.
It's my history teacher.
Okay.
Sometimes just looking at her gets me mad because she just has this attitude. Like just when I walk in. And then, it's such a boring teacher, so I tend to sleep in class. I can't help it. And then she'll call me out for the whole class.
Mm.
And it just makes me mad,
Mm-hmm.
and we'll start going back and forth, saying stuff, and because I ended up cussing her out, and that's when I had to go to detention.
Mm-hmm. Mm-hmm. ISS. Okay. So you're in class, teacher's calling you out, and you're responding with a lot of anger and cursing. Get you in ISS. Okay. Okay. Jane, good example. Is there any time when there's anxiety that's happening before the anger comes out?
What do you mean by anxiety?
Like, maybe, if you ever get anxious where you just kind of freeze, or is yours more of a reactive, of a fight, of a lash out, of a get it out? That's kind of your
definitely
response
when I feel something,
mechanism.
I have to get it out.
Okay.
I can't even think of a time when
Okay.
I actually stop and think.
Okay.
Yeah.
Okay. That's good. All right. Well, I want you to, it's kind of helpful, I think, to understand a little bit about what's going on in your brain, and then you can maybe help monitor it, help control it, help manage it a little bit better. Okay? So let's, I'd like to take you through an example of something. It's called, and it's a way of, it's called wise mind. Okay, you're trying to be very conscientious about what's going on around you, how you're feeling, and how you're going to react. You're just being, instead of just reacting when that alarm goes off, you're going to think about it, name it, and then react. And hopefully maybe we can get a little bit of more control on the anger reactions coming.
I need that.
Okay.
I don't really see,
all right.
I don't
Okay.
see myself being too good at it, but
Okay. Well, you know what, Alyssa? Knowing that you need that, just saying, I need that, that's a really big step. It really is. Some people don't even acknowledge that they need it, don't want to acknowledge it, don't care to acknowledge it, and they're not going to really get any, not going to change. But you're here. Maybe you don't want to be here. But I'm hearing you say that you want to make a change, and that's really huge. Because I think you want things to be different for yourself, it sounds like. I mean...
yeah, but also just wish people would stop messing with me.
Okay. Okay. All right. Well, there's a desire there, I see, and I appreciate that, and that's great. And there are lots of different techniques for this, and I'm just going to offer one today, and then you can practice it all week, and then when we talk next week, we'll kind of see how you are with that, and if it's not working for you, we'll make modifications, we'll make changes, okay? Okay. And this is a technique where you can do it at school, at home. It only takes about 1 minute. Sometimes we don't have a lot of time. You know, it's great when you can take 15 minutes to calm down. Maybe you're going to bed at night and you're doing something that makes you calm down and it's quiet. But a lot of time, in the heat of the moment, we don't have a lot of time. Or when you feel that anger rising, there's not a lot of time, all right?
Yeah, it happens.
It happens a lot.
Yeah.
Okay. This little procedure is called S.T.O.P. S-T-O-P. All right? It's a little acronym, S-T-O-P. So S-T-O-P. So it means the S is to stop. So, for example, you're watching TV and your mom says, Alyssa, can you do the dishes, please? All right. Right then and there, you're going to say, okay, stop. And then you're going to take a breath. Okay? You're going to breathe in pretty deeply, and you're going to breathe out. Just like take 2 deep breaths. And think about your breathing. Breathe in and breathe out. Okay? So the T is for take a breath. All right? Take a breath. All right. And when you're taking a breath, think about, you know, your brain really needs a lot of oxygen. So when you're breathing in, you're breathing oxygen into your lungs, gets into your blood, gets to your brain. You're getting a lot of oxygen in your brain, which really helps you think better. All right? So you're breathing in, Getting that oxygen up there. All right. The O means observe. What is going on around you right now? All right. So in this situation, your mom asked you to do the dishes. You're watching a program. All right. You'd like to finish the program, I think I heard you say, and then you're going to do the dishes. That's how you would like it. May not be how mom would like it, but you might be able to, if you can kind of observe the situation and how you're feeling. I'm a little mad. Mom just asked me to do it. Doesn't she see I'm like watching a show here? All right? So you're observing how you're feeling. All right? I'm watching the show. I'm getting frustrated that she's asked me to do this right now. Observe it, name it, claim it, and say, okay, that's how I'm feeling right now. All right? So you're just aware. You're observing the situation and how you're feeling. Okay? And then the O is for observe. And the P is for proceed. That means move forward with something that's going to benefit you. That's going to be positive. That's going to work for you. Yelling at your mom. Is that working for you?
No.
Get you in trouble. Get your hand in the wall. You might get hurt. Moving forward, yelling at your mom's not working for you too well, is it?
No.
Okay. So we're going to proceed with something that's going to work for you. In this situation, do you have an idea that might work for you?
I just talk to her, but it's just so hard to talk to her without like yelling. But I guess if I stopped, and I wouldn't be like quite so mad. So I just tell her that I'm gonna do it later. But I see okay pissed off about that. I just want you to do it now. So.
Well, it's a good idea, though. It's a good thought. It might be worth a try to say. And maybe it's more, instead of telling her I'm going to do it later, saying, Mom, I got 10 more minutes with this show. Here's 10 more minutes. I'm really interested in this show. Can I just finish the 10 more minutes and then I will do the dishes? Kind of put it in a question. So, instead of, say, I'm going to do it later, say, I just got 10 more minutes and I really want to finish this show. Is it okay if I just do the dishes in 10 minutes when I finish this show? Does that sound like something that maybe?
Yeah, that's what I said before, but I was kind of, I probably won't have like the way I was saying it and stuff like that. So.
Yeah, I hear that. Well, I'm glad you can acknowledge that. That's really good. That's a real good step. That's a real good step. So let's step through that one more time. S.T.O.P. The S is for
stop.
Yeah. All right. Stop. Before you react, before you respond in anger, you're just gonna stop. What's the T?
Take a breath.
Exactly. Take a breath. You're getting the oxygen into your brain so you can think clearly, rationally. Take 2 big breaths, 3 maybe. O. Observe. What's going on? What's going on in my body? What are my thoughts? What's this situation? How am I feeling right now? Name it. Claim it. Okay. I'm really frustrated here. Mom asked me to do this. Mom to finish this. All right. And then what's the P?
Proceed.
Proceed. That's right. Proceed. How am I going to go forward in a way that's going to be helpful to me or good for me or benefit me, right? So what in that situation, what's the P going to be? What's the proceed going to be? How are you going to proceed?
Just talk with my mom, like, calm her.
Yeah, in a calm voice. Ask her, as soon as this program is over, can I do it, Mom? I really want to finish this, then I promise you I'll do the dishes as soon as this program's over.
Yeah, like a compromise.
Yeah, there you go. Yeah, there you go. In that situation, very good. You're getting a little bit what you want. She's going to get what she wants. It's a great compromise. Yeah. Worth a shot. Worth a try.
Yeah.
Okay.
Sure.
Yeah. It takes a lot of time to make a change. It really does. You've been doing it one way for a long time, and it takes a lot of time to do something different. So I want you to be patient with yourself. I want you to try this every day, all right? And if you can kind of make notes for me, and so we can talk about it next week. Like on Monday, I had a fight with my mom. I tried it. It didn't work. On Tuesday, I had a fight with my mom. It worked a little bit. You know, and the more you do this, the better you're going to get, and the more it's going to benefit you. All right? The more it's going to benefit you.
Yeah, I see it being a little struggle in the beginning.
Absolutely right.
Just the way like we talk with each other, it's hard to just stop and zone at me and stuff.
You're right. You're right. Because there's a certain way in the house, and it's going to be, be patient with yourself. And realize this is going to take some time. Okay? Let's think about at school, a situation, if you wanted to take that one situation at school too. Okay?
Yeah.
Say you're in history class. You and your history teacher don't get along so well. So you're in your history class, and she's calling on you. Right? And this is when you get angry. Am I correct about that?
Yeah, so
Okay.
how can I stop when like she's calling on me? Like I have to
Okay.
answer.
Now, is she asking you, so is she saying, okay, Alyssa, tell me the answer to this question? Is that what she's calling? Or is she saying, Alyssa, wake up because you're asleep? What is she saying?
She wants to, trick me because she knows I was sleeping, not paying attention. So she asked me like the answer to the question, and obviously I don't know. So.
Okay. All right. So let's kind of step through this stop process with that. All right, so the teacher's going to ask you, Alyssa, why don't you tell us about that? All right? Instead of, what's the normal reaction for you? Your alarm center's going off. What's the normal reaction for you?
I don't have to know, teacher.
Okay,
Yeah.
all righty. You're going to try and just stop. All right? You're going to take a breath. 2 breaths. You're going to say, all right, how you feeling at that point? She's embarrassing me.
Yeah.
What else is going on?
Anger.
Okay? Anger. She knows I don't. She's just trying to test me. She knows I don't know the answer because I'm asleep.
She just knows. She can call anybody, but she just keeps messing with me. So.
She's just messing with me. So it's frustrating. Exactly.
Yeah.
Right. I'm kind of tired of it. So you're naming that. All right, I'm frustrated. She doesn't know the answer. Why is she calling me? Okay. You're observing what's going on in the situation. But how are you going to proceed in a positive way? All right? Instead of yelling and getting sent out of the room, can you think of a way that might benefit you more? That might be to your advantage. Getting out of the room and going down the hall is not helping you too much. So what's a way you can proceed? You are frustrated. You are maybe a little bit embarrassed. You maybe don't know the answer. What can you do instead of yell at that teacher and get angry at her? You have a thought, maybe.
Yeah, that's tell her I don't know.
Okay.
I don't really know what is to say other than.
Well, that's the truth. You might know, or you may not know, but that's the truth. And you can say just simply that. I don't know. Yeah. Then she's going to go to somebody else, right?
I mean, maybe.
Maybe?
Yeah.
Yeah. That'll be the hope, that she goes to somebody else. Yeah. But for you, you won't be sent out of the room. You won't be getting in trouble. You won't be in ISS for the day and missing out. Yeah. One objective I want for you in school is for you to get to the next grade. Get to the next grade, you got to be in that classroom. Learn a little bit so you can get to the next grade. So.
Yeah, I don't want to.
Yeah, that's good. You've got a desire to do that. So this procedure is only takes 45 seconds or so for you to stop, take a few breaths, observe what's going on, kind of name your emotions. Okay, I'm this, and this, and this. However, don't want to respond with angry words or yelling or cursing because it's not going to benefit me. Trying to make a change here. Then I'm going to figure out what is my best tool to proceed that's going to help me. Work out arrangement with mom, or just Tell a teacher you don't know. Okay?
Yeah.
And again, be patient with yourself because this type of change takes a while.
Yeah, it's probably gonna take a while.
Yeah, yeah. Are you willing to maybe practice this once a day, every day? It can either be at home or it can be in the classroom this next week.
Yeah, I mean, if something comes up,
Yeah.
I mean, something's always going to happen.
Okay. Well, to just try it and see how it works. And if this, I have a lot of tricks up my sleeve. So if this one isn't working, we can modify it or we can try something else. But try this every day, and then we'll just kind of talk about it next week and just kind of see how it's going.
Okay.
Okay.
Yeah.
All right. Well, thanks for coming in. Listen, I appreciate you wanting to make a change and willing to do something about that.
Okay.
All right. All right.